I'm 30 weeks pregnant and feel pressure down below.
Before you freak out, remember that your body will go through practice contractions weeks before you are actually in labor.
Those are called Braxton Hicks contractions.
They can take the form of one group of muscles squeezing as a band across the uterus or an entire uterus pressure squeeze once before stopping.
What is the difference between that and contractions like when you are in labor?
The pressure will either not stop for hours while you start to think you have back spasms too, or the squeezing will get worse and more painful.
I know that if the mucus plug comes out that I may be in labor.
The same squeezing down there can cause you to poop a lot. End result being you may not notice that the mucus plug came out among everything else leaking out.
That sounds so gross.
If you are in labor, you will have your water break and a baby come out, and that's along with an afterbirth.
I don't want to have the baby this soon. We're only 75% of the way on the status bar.
Not all pressure means you are in labor, though if there is blood down there for any reason, you need medical attention.
I know bleeding is bad.
If you have pressure in the stomach and you've had a urinary tract infection, you may have upgraded to a bladder infection. That causes pressure in the pelvis and even blood in your urine.
The difference being I'd notice blood in the urine and know that wasn't due to potential labor.
Sometimes you feel pressure in the bottom of the pelvis because the weight of the pregnancy is straining things, though if the pressure comes with a particular muscle or tendon hurting, you may have pulled something.
I'm lugging a lot of weight around.
This would be like pulling a thigh or hip muscle getting up off the floor, or twisting while holding something, or trying to do not prenatal yoga.
I know what a muscle strain would feel like.
Not if you strained a pelvic muscle by stepping at an awkward angle or trying to walk in high heels.
I haven't worn heels for months.
There is the fact that pelvic pressure and pain due to the growing load of the baby is common in the third trimester, until the baby actually shifts down into the birth canal right before birth.
I have heard that described as feeling like the baby is going to fall out.
The best way to tell the difference between standard pelvic pressure and pain that is a prelude to labor is to go for a walk.
You just said I may have strained some muscles.
You can feel pelvic pressure because the baby is straining pelvic muscles, especially if this is a first pregnancy, so the pelvis is widening for the first time due to pregnancy.
This is our first.
If you go for a walk and the pressure becomes pain and it is severe, you need medical attention for a possible strained or damaged muscle or tendon. If the pressure becomes periodic pains, you're feeling the onset of early labor.
Both of which are reasons to get to the hospital to resolve.